Hey everybody, hope y'all are doing well. We're going to go ahead and get started here in just a few minutes. We're letting a few people kind of filter in from the waiting room and different things like that. So appreciate y'all being here. We're going to go through a few of our devices and how they function and do a little bit of a Q&A and talk about updates from the company. So appreciate y'all being here. We're going to go ahead and get started here in just a few minutes. Welcome, everybody. For those of you who just hopped on, we're going to get started here in just a few moments, but we're going to be reviewing the product techniques and differing things for our PRP devices, how they function, a little bit of a Q&A, and a company update. Again, if you're just hopping on, thank you for joining. We're going to get started here in just a couple moments, waiting for a few other folks to hop on and get situated from the waiting room. For those of you who just joined, we're going to go ahead and get started here in just a few minutes. We're talking through both of our platelet-rich plasma concentrators this afternoon, a couple company updates, just doing a Q&A after we talk through the product techniques and how to use our devices here at Celling Biosciences, and ultimately, depending on which therapy you're looking to do, targeting the Buffy code or the platelet-poor plasma and how to process that, as well as leukocyte-rich and leukocyte-poor preparations. We're going to go ahead and get started because it looks like we've reached a quorum and it's a few minutes past the hour. So I'm going to hand it over to Gracie here. She has been with us for about a year and a half now, is one of our biomedical engineers here on staff, and is actually in our HQ just downstairs. For those of you that are not familiar with the Austin, Texas property, you need to come visit us. It's a ton of fun. It's a great city, not to mention. But, we've got the corporate offices on site, and then we also have all the warehousing where we do some of the assembly and shipping and receiving and different things like that. And then we also have our laboratories on site as well. So everything that we do here is centrally located in Austin, Texas, on the same campus, which is a ton of fun. Especially for us in sales and marketing. We have the opportunity to really meaningfully interact with the client in a way that we otherwise can't, because we've got so much of our operations and back office and R&D and everything in-house. So I'm going to hand it over to Gracie. She's going to do a brief introduction. We'll be off to the races.
All right, hello everyone. My name is Gracie Cuba, and I'm an associate engineer here at Celling Biosciences. Like Parker was saying, I've been here about a year and a half, and I work on engineering as well as our product development. I also am in charge of the lab down here and do any trainings that we might have coming through. So our lab is fully functional. We are open for any demos, trainings, or cell counts that you may need. And I'm really excited to be down here with you guys today, talking about our PRP devices. So welcome to our PRP Power Hour. Today, we are going to be covering our two-step device as well as our PRP Plus. So both of these are our main line of PRP concentrators. So they're going to function a little similar in the way that you put whole blood in both, spin them down, and you'll see your blood stacks. However, just to give you a quick background, they are a little different. Our two-step has 2 chambers included. So you can do one of 2 preparations for that one, where your back chamber is going to be used as an extra concentration factor. And our PRP Plus is really unique because it has an integrated filter right there in the device. So you can do everything within that singular device, which is really unique to us and we really like. So I'm going to talk a little bit about those two. Also, something really exciting is some of the updates that we have product development wise, especially to our two-step. This will make a little bit more sense later when I'm kind of showing you how to use the devices. But right now, when you are using your thumb wheel and selecting where you are in the stack, you can see a white O-ring coming out of the piston, and that's kind of where you would visualize where you're at in that stack. Sometimes that can get a little bit hard to see, especially if you're doing a loop site 4 prep, where that prep is a little bit cloudier. And so we have recently developed a wheel of sorts that will extend to the edge of the piston so that you can visualize where you are in the stack a lot better. So Parker will be touching on that a little bit later too, but we're really excited about some of the stuff we have coming up. And with that, I would like to go ahead and get started with the two-step. So when you first get your two-step kit, it just comes in the box, as you can see here. So our kits are really cool because they come with every single thing that you would need to process the device, from the blood draw to, pulling your PRP out. When you get your device here, you'll have those three different pouches. So you'll have your processing pouch, your blood draw pouch, and your device. So before we kind of get into some of those components, I'd like to talk about the two-step and the different preparations that you can do with it. So one of the standard ones, and the one that's used most frequently, is just the standard PRP preparation, which we refer to as leukocyte rich. So obviously it's in the name there, you're going to have a few more leukocytes in this preparation. And for this, you're only kind of utilizing this front chamber here. So you would fill this up with 60 cc's. You would spin this down at a harder spin than our leukocyte 4 preparation. So that's going to be 3,200 RPMs for 15 minutes. Then you would collect your PPP off the top and put it in this back chamber here. And in this preparation, the back chamber is used more as a reservoir if you needed to supplement extra volume from your PRP draw. So after that, you would go down and grab your PRP out of here, and it would be ready for re-injection. So that would be your standard PRP prep. Today, we're actually going to be showing you the leukocyte 4 prep so that I can kind of show you how both of these chambers work. That one's going to feature a softer spin at first. So when you put in this front chamber, you're going to do 1900 RPMs for 10 minutes. And what that's going to do is make it a little bit more cloudy. There's less leukocytes floating around up there. And you'll be able to see all this when I'm going through it later. But then you take that, put it in the back chamber, and do a hard spin. And that hard spin is going to pelletize those growth factors and proteins that were in your PPP. And a cell pellet will form right here. So that's kind of the cool thing about the two-step, is that you can do two modalities with it. Both are really effective and have shown great results. It's kind of a preference if you like leukocyte or leukocyte rich better. But yeah, that's some background before we get started. So like I said, we're going to be doing a leukocyte 4 prep today. So we can go ahead and start with our blood draw pouch. So this pouch is going to have everything you need to get started here. So you're going to have anything from your butterfly needle to your tourniquet and your Band-Aid for the actual blood draw. And then you're also going to have your 60 cc syringe. So we include a 60 cc syringe in our kits because that is the absolute optimal volume that we recommend when drawing blood. It just really gives you the best volume of your good stuff, or your growth factors and proteins in that buffy coat, in a higher concentration. So 60 cc's is really the best volume that you can get, and that's why we have this set up this way. But it's really important to note that before you get started, you need to make sure you have the ACDA in your syringe, which also comes in your kit. So you would use your blunt fill needle, attach it there, and draw your ACDA out first. So we do this at a 10% volume. So if you want 60 cc's total, you would do 6 cc's of your ACDA and 54 cc's of blood. So that being said, I'm going to go ahead and fill the device. So like I said, we're going to draw 60 cc's out of here. And I'm not going to add ACA. It's already in there for us today. So we're going to fill this. And then to insert into the device, you are going to go ahead and remove the cap off of port A. So if you can see that, port 1, is right here. This is port 2, and then port 3 is in the back over here. So we're going to put it in using port 1. And while you're filling the device, when you take this cap off, you want to make sure you're setting it face up on your surface to maintain sterility. Go and attach your syringe to port 1. And slowly start filling your device. You want to make sure that you're going at kind of a slow rate when you're filling this, just so you're not creating a lot of bubbles up in there, especially at the end when you're getting down to your last 10-ish cc's. And also it's important to note that before you spin or load your device, you want to make sure that your thumb wheel is all the way up. So this orange part right here, it comes like that, but it never hurts to double check. Then you're going to go ahead and put your cap back on, and you want to make sure that you're tightening down all of these caps before you spin. And it's as simple as that. So now we're going to go ahead and put this device in the centrifuge, but first we need to weigh it against the counterbalance. So for the 2 steps, your counterbalance is just going to look like another 2-step. And when you purchase one of the kits, it comes with all of this necessary equipment. So you'll have a scale, a counterbalance, and a centrifuge, so that all of this is just incorporated. So we're about 239. So when you're doing this, you want to get within a gram or 2 of the weight of your full device. The centrifuge will spin at about that air level. However, if you go a little over that, the centrifuge will time out just because the weight imbalance will be a little too much. All right. And then you want to check one more time. Start at 139. And 139. So we are good to go ahead and put these in the centrifuge. So this is one of the centrifuges that we offer here. So when you load these devices, you are going to want to face these orange thumb wheels towards the rotor of the device. It kind of bounce as well. So it should be seated like this in here, and it's just important to make sure that these orange ones are facing in towards each other. And like I said, we're going to be doing a leukocyte core. So we're going to go ahead and set our centrifuge to 1900 RPMs for 10 minutes. So to do that, you're just going to hit your set button until you get to your speed. You can go ahead and hold down on this button. Hit set again, and you're good to go. Hit enter and start. So that's going to go ahead and spin for 10 minutes. And while that's going, I'm going to go ahead and introduce our PRP Plus and load that up so we can spin that one too. All right, so our PRP Plus kit is going to look very similar. It's also going to have all the components necessary for blood draw, processing, all those good things. So here is the processing pouch and the blood draw pouch. And then our device. So if you can see here, this is the filter I was mentioning earlier. And this filter is really cool because it is unique to us. It was designed and its size was designed to go ahead and filter out saline out of the device so that when you are pushing your PPP through here, you have a really good concentration coming out on the other side. So you'll see how that works a little bit later when we get into it. But for now, we can go ahead and fill the device. So we're going to take our 60 cc syringe yet again. And remember, you would need to put your ACDA in, so another 6 cc's of ACDA. Going to go fill. Oh, let's 60. So for this device, the ports are going to look a little bit different. So you have port A on top, and then that second port over there, and then B and C are on the sides. So to fill, we're going to put it in through port A. And remember to set your cap up facing for sterility purposes. I felt any extra blood. And again, you want to make sure that your thumb wheel is totally upright before you start, as well as your valve down here is in the neutral position. So everything looks good. So we can go ahead and start putting this blood in here. And it's important to go slow on this one too, and not just for the bubbles, but also because this one's a little tighter fit in here. So you might see some blood start to bubble up here. It's not a big deal if it happens. It usually does. You just need to wipe it up a little bit before you put it in the centrifuge. So that's ready. You're going to put your cap back on. Same thing here. You want to make sure that all of these caps are pretty tight on here. And then your PRP Plus device is ready to spin. So we are going to weigh this one out against a counterbalance as well. So for this one, the counterbalance looks a little bit different. It is going to match the center of mass a little bit better here. So same thing here. You want to make sure it's within a couple of grams or so. Here, 254. And 254. So we can go ahead and load this one into the centrifuge. So this is another one of our centrifuge options here. It's a little different than the other one, but they function pretty much the same. So we're going to go in here, and when you're loading this one, this orange thumb wheel is going to face out. So remember, that's the opposite of the two-step. The two-step we have facing in, and the PRP Plus is going to need to face out. So then on this counterbalance, this little flat part will also need to be facing out. So this is already set, but if you needed to change it, it would look exactly the same. So you just hit enter until you needed to, set until you toggle over to the value that you needed to change. And when you're all done, you would press enter. And we can go ahead and start that one. So while both of these devices finish processing in the centrifuge, I'm going to start it back over to Parker, and he's going to tell you a little bit more about some exciting things you have coming up.
Hey everybody, hope y'all are doing well. Just a couple quick updates from us here. The main three things that I wanted to discuss are the site wheel, which Gracie touched on earlier, which is an improvement to our existing two-step system. It allows the provider to really target where the collection window is, which of course allows for a maximal concentration of that buffy coat with ease and a capturing of that. Making sure we understand exactly where that collection window is in relation to the red blood cells, the buffy coat, and then of course the platelet poor plasma on the top of the stack. So here is a first look at that right there. Whereas before we just had an O-ring kind of in that central column of the collection of the two-step, this actually goes out to the edge of the reservoir here all the way around. So again, even in difficult conditions with high hematocrit or otherwise, the provider can easily identify exactly where the collection window is and how we're doing that. The ultimate thing here at the end of the day is, while this is not a wild improvement, we had heard from a number of providers one of which is actually on the call today, that they were having to use a flashlight within some of the procedures sometimes in order to make sure that they were right on top of the Buffy code for collection. Because, you know, you go through this work of having a premier product in Celling Biosciences, and you do the centrifugation and the blood draw and all these things. And of course, then you want to make sure that you're maximizing the biologic product that you're taking in the right amount of volume for your patient. And we really wanted to make sure that that was kind of a core feature of our product. And we weren't pleased with the fact that a lot of people were having difficulty with that. And so one of the things that you'll notice if you happen to already be a customer of ours or are thinking about being a customer of ours is being a design house first. And being in relationship with the market and iterating, therefore, in our engineering practices and our R&D is really core to who we are. Yes, we're a sales organization at the end of the day. That's what keeps the lights on, right? But why we got into the business and why we do what we do is not really just for the distribution, but it's for the pushing the envelope as far as regenerative medicine is concerned, especially as it pertains to biologics, and listening to market feedback and then iterating and making our devices better. Almost every single one of our products that was not part of an acquisition has been, developed in part with the assistance of one of our customers. It's something that's really core to who we are. And we're excited to be releasing this product, not because it's this big generational leap, but because we know it makes y'all's day-to-day and operating the clinics that you all work in and own a lot easier, and ultimately making it to where we can achieve better patient outcomes and really do what we want to do best. So this will be released in just a few months. We have them in production now, and they're headed to assembly, and then of course we'll go to sterilization and all those sorts of things. But it is done, it is ready, it is being manufactured, and so I'm really excited for that to hit y'all's clinics and practices either towards the end of the year or the beginning of next year. So that's the first major update. The second has to do with our Thermi system. In the middle of 2022. It was something that we were working on for a long time coming out of COVID, and it was an iterative improvement and in some aspects, and then in others it was a generational improvement. A few of the core things that are notable about our newest platform, the RF Plus, is it features a dual watt functionality. This exists in the space, but is somewhat uncommon for more of the delicate procedures, one of which would be the treatment of dry eye that we have with one of our handpieces. You're going to need that lower wattage threshold while still taking advantage of the same frequency and the same temperature control algorithm. The dual wattage functionality is fantastic for that. On the other end of the spectrum, you've got modalities like ThermiTight for skin tightening and skin laxity, and that just needs a little bit more power behind it because we're melting fat and doing some of these tightening things that ultimately require just a little bit more of a, little bit more of a kind of hands-on approach and a little bit more power from the device. And as such, we needed to keep that functionality in there. And so really optimizing the temperature control algorithms for the different applications that we have on the device and also the different wattage modalities was a big part of this jump. We did that all throughout COVID and worked really hard to make sure that we maintained a price point for the market, and also were able to continue to offer a lot of these modalities, not only for just aesthetics, but wellness and orthopedic applications as well, all on the same platform. So we're able to achieve that and release it to the market in mid-2022. And the most recent iteration on that, or generational update, really is the release of our ThermiFit Mini. It is the largest of our ThermiSmooth hand applicators. It is a 30 millimeter. 30 millimeter, for those of you who are familiar with the platform, is 4.1 times the size of our largest previous handpiece, the 15 millimeter. So this is really much more interesting for the pre-treatment of orthopedic applications, which is specifically relevant to biologics. So you can pre-treat in any sort of joint that you're going to be injecting with this radio frequency to prepare the environment for those biological constituents. Radio frequency is most well known for its kind of its ability to onset not only collagen reformation, but also angiogenesis. So you've got this increased viability of the soft tissue within the space and also an increased blood flow. And so a lot of our providers are starting to use this really on any sort of soft tissue or joint application that they have. Some of those are orthopedic, some of those are aesthetic based, right? So doing a ThermiSmooth treatment on the submental area or the face prior to some sort of a biologic facial or hair restoration or something along those lines. So we're really excited about this handpiece. It's only available on the RF Plus. It is made of silver. We found that silver was a better option as opposed to the industry standard of stainless steel for the conductivity of radio frequency. And so we built this into this handpiece, and we'll be moving all of our handpieces over to that. But silver not only is a better conductor of radio frequency, but also is antimicrobial and has a number of other properties that make it really a beneficial option for a radio frequency handpiece. So we're really excited about this. We've got a number of units out in the field with our RF Plus providers, and they're pretty excited with what it's capable of doing. Everything from faster facial treatments to treating the submental area to a pseudo body sculpting type application. We're working on larger handpieces right now. And then, like I mentioned, the pre-treatment of joints for orthopedic applications. So that kind of rounds out the Thermi update. And the last one is fresh off the prototype conveyor belt, so to speak. This is the CellProbe 360. CellProbe 360 is a novel approach to aspiration needles. The industry has been using the same Jamshidi needle for about 200 years for bone marrow aspirations. And we were dissatisfied not only with the thought that has gone into that product, just because it was created for biopsies and biopsies alone, not for orthobiologic applications, but also with its inhospitability towards the Hernigo aspiration method. And so we optimized this product for that. We've got a disposable handpiece here that can come with the handpiece, but also you can use your own instrumentation handpieces that you might be comfortable with in your practice that uses a quick change Hudson fitting. And in using that, it's, we've got a number of people that have ratchet applications that they like to use, or sort of teardrop handle type things, or their own T handles, just of a more robust material. Really anything, whether it be an orthopedic or spinal instrumentation that they like using in their practice, they can put it on top of this device as opposed to the disposable handle. And that's a really convenient feature. The other thing, which is really the core technology and functionality of this device, is inside of the needle itself, we have a series of tubing systems and one-way check valves that allow for a reproduction of quick, drastic draws from the bone marrow. So you are consistently on new ground for a number of cells. You have the ability to draw in such a way that you are pulling more stem cells off of the bone marrow structures and scaffolding in the tissue, the iliac crest. And then lastly, you save a lot of time and don't have as many sterile breaks because we have a 10 cc syringe attached as well as a 60 cc syringe. And after you've drawn out of the iliac crest, you just push forward that 10 cc syringe, and the bone marrow aspirate will flow into a reservoir syringe. So there's not this difficulty of attaching and reattaching and detaching a number of syringes, but rather you just have a 10 cc syringe and a 60, and it allows you to perform those draws according to Hernigo's aspiration method, and then depress that syringe and move all of the aspirate into the reservoir syringe until your draw is complete. We expect these to be ready by Q1 of 2025. We've done a number of iterations on this just to make sure that we got it right, but we're really excited to see these out in the field. Those are the three major updates from us. Obviously, if you have any further questions about product development or what our product development pipeline looks like, you are welcome to come visit us here in Austin, Texas. We love hosting people. We had a number of doctors and distributors in this morning looking at some of these things and talking about how we grow our business together. And then also, you guys know your reps and you know your distributors very well. So please don't hesitate to reach out to them and ask questions. And if it's something that I need to hop in on, I'm happy to. I know a lot of you all have my cell phone number and we talk often. So thank you very much for listening to me. I think we've gotten to the point where the centrifugation is done on some of these things. So I'll pass it back over to Gracie. She's going to walk through the deconstruction of the stack and really how we assess a biologic product in our devices. And from there, we'll do a little bit of Q&A and then we'll be done. So appreciate you all. Thank you.
All right, so our two-step just finished its first spin, so we can go ahead and grab that out of the centrifuge. So when you're taking it out of the centrifuge, you of course want to be a little bit careful not to mess up the stack, but just try to keep it as upright as you can. And as you can see here, you have your red blood cells down here. You have your buffy coat right here. It's a little bit harder to see again in this preparation because it was a slower spin and a slower time. This is kind of what the leukocyte pore usually looks like. It's usually a lot cloudier, especially up here in this PPP layer. So if we would have done a standard leukocyte rich prep, this PPP layer here would look a lot more yellow and a lot more clear. So the thumb wheel, when you're moving it down, it would be a lot easier to see where you are. However, with this one, it does get a little bit difficult to see. But basically for leukocyte pore, we are going to go ahead and take this PPP off the top of the buffy coat, and we're going to put it in the SPAC chamber. So I can show you what that looks like. So we're going to start with a 30cc syringe, which is also included in the kit. So before you do anything, you want to make sure your syringe is unlocked so that when you get it on there, it doesn't get stuck. So to do that, you just pull on the syringe. You can see it was a little difficult for me to do that, whereas now it's easy. So that means your syringe is ready to go. So we are going to use our thumb wheel now to move our collection window down to where right above the buffy coat so that we can draw up that PPP. Our thumb wheel is really cool because it's unique to us and it allows you to auto select where you want to be in the stack. So what that means is different patients have different levels of hematocrit and saline. So this stack can kind of vary from patient to patient. So it's really important to have the flexibility of this thumb wheel to be able to choose where you want to be in this stack. So I'm going to start spinning it down here. And you'll see a white O-ring start to protrude a little bit. So like Parker was saying, sometimes you do have to use a flashlight. So I'm going to show you that because this stack is a little dark. So we can just do it here. So when you're spinning it, you want to stop about 2 millimeters above the buffy coat. So about there. Because when you are drawing up your fluid, you are pulling from the bottom of that O-ring and you cannot possibly draw more than where you set it. So it's really nice. It's kind of like a self-stopping mechanism as well. So once again, we're going to remove the cap from port 2 this time. So you're going to be right in the one right above the thumb wheel here. Going to go ahead and attach your syringe. And we're going to pull up this PPP layer. So we're going to slowly start drawing. You do want to do this one pretty slowly because, again, you don't want too many bubbles before you put it in that back chamber. So as you can see here, you can still see that white line of the buffy coat. And we did stop at about 2 millimeters above. So this is what you are now going to put in the back chamber. So to do that, you're going to remove the cap from port 3. Again, make sure you set it right side up for sterility. Hold on to the thumb wheel and twist this one off. And go ahead and reattach it to port 3. And then you can slowly start putting your PPP back into the SPAC chamber. So like I said, we're going to do a harder spin now so that we can concentrate down the nice cells left over, those growth factors and proteins that are left in this PPP. So that, if you were just doing a leukocyte pore prep, that's where we would go ahead and stop. However, I'm going to show you how to get the PRP out. More so if you were doing a standard PRP prep, just so you know what that looks like. But again, for this spin, for the Looksite 4 spin, you wouldn't usually do this. So you would drop your collection window down again. This time you want your O-ring to be below the buffy coat. And you can attach a 10 cc syringe to your thumb wheel here. And you can do a quick pull up on this. So now this would be your PRP from your two-step device. This is now ready for re-injection. If this was the standard PRP prep and you wanted a little bit more volume, you could come around to your back chamber and pull some out of port 3 until you're satisfied with your re-injection volume. But if not, then this is ready to go. That being said, we're going to move back over to our Looksite pore prep. So again, you want to make sure that all of your caps are tightly on. And now we're ready to spin this again. So you won't need to reweigh because you shouldn't have taken any volume out usually. So you'll go ahead and put this back in. Like I said, we're doing a harder spin this time. So we're going to go ahead and go over and we're going to do 3,200 RPMs for 10 minutes. So this one's ready to do its second spin. So we're going to go ahead and start. Sorry, I pressed. There we go. All right, so while that one's spinning, we can transition back over to our PRP Plus because it is now ready. So Centuries is still slowing down here. So I'm gonna go ahead and grab my kit. We'll just wait. So you can also change how fast or slow this kind of slows down using your rotor speed here. Obviously we're on 1, so it goes a lot slower than if you had it a little higher. So you can go ahead and get this out here. So we can go over here. All right, so this is what our stack looks like for this one. As you can see, it's a lot clearer up in your plasma level here. Because we're using bovine blood today, they tend to have a lot more saline in it, which is why you can see a lot more of this clear PPD here. You can still kind of see our buffy coat right along the edge right here, and then our red blood cells here. So for this device, we can start processing. So again, this kit's going to come with everything you need. We're going to have a backlock syringe, 1 30 ml syringe, and 2 more 30 ml syringes. So same thing here. Before you do anything, you want to make sure that you're unlocking all of your syringes. Including your backlock. And what's going to happen with this device is we are going to connect syringes to ports C and B, as well as on the bottom of the filter here. So to do that, we're going to go ahead and take off our filter caps from all those places, making sure you're setting them right side up again. You'll go ahead and screw these in. And then this one we're going to get to in just a second, but we can go ahead and put our backlock syringe right here on the bottom. And we're going to leave that one alone for right now. So once again, we have our thumb wheel. This once again is going to allow you to self-select where you want to be in the stack. So for this first straw, we're going to pull out this PPP and we're going to use the filter to concentrate it down. But first you want to go ahead and get it out of the stack so we can start turning our thumb wheel down. And in this one, it's going to look a little bit different. So your collection window is actually going to be in between these 2 O-rings. So remember on the 2-step, it was below the O-rings, so you had to sit right above the buffy coat. But for this one, you're drawing from right in between. So we're going to go down. So you're right above the buffy coat here. I know it's kind of hard to see, but the buffy coat is kind of right above right here. So now you're ready to draw through PPP. So you're going to go ahead and move your valve to draw. And you're going to pull up on your syringe on port B. So same thing here. This will stop me when I've gotten to the volume where I set my collection window. So now we are going to go ahead and go to filter and pull a vacuum on our backlot syringe. What this is going to do is create it to be able to be filtered through that filter back here. And once again, this filter is really cool because those pores were designed so that the saline will come out. So as I start pushing it back and forth, you'll start to see the water come out or the saline come out of your PPP here. But before we do, well, so first, we're just going to push it back over to the port C syringe. So to do that, you should still make sure that your valve is on filter. And then you can just dispense your port B syringe. So as you can see, we ended up having the volume over here in our port C. So now, before you start filtering out, you do want to get your buffy coat out of there. It's going to be a little bit difficult because, like I said, this was bovine blood, so we have a lot of excess saline in there already. But I can go ahead and show you as close as I can to what that would look like. So for this device, it's just really important to remember to be moving your valve around depending on what you're doing. So before we move our thumb wheel again, we want to make sure that our valve is pointed straight up. And then we can go ahead and move our thumb wheel down. I'm just going to go as far down as I can. Well, we might get a little bit of the buffy coat. It'll be kind of close. But you would leave your same syringes on and do a quick pull. Sorry. See, that was a good example. So you want to make sure that your valve is now on draw. And then you would do a quick pull to get your buffy coat out. So again, we got most of the leftover saline, but in a perfect world with real blood, you would have a little bit more red blood cells and your buffy coat would be a little bit higher. So this would be your PRP. So before we start filtering anything again, we're going to take our PRP syringe off. So to do that, you want to pull up a little bit on this so that you don't have any leaks while you're twisting off. And then you can get some of that air out of there by just pressing up on the syringe. And that, in this case, would be your PRP. And then also in the kit, we have all of these little syringe caps. So we're going to go ahead and cap that. Set that aside for later. And then we're going to take our other 30 cc syringe and reattach it here. Again, put that in neutral before you do that. So now we're ready to filter our PPP down. So I'm going to go ahead and turn our valve to filter. And I'll put it up here so you guys can see. So as I'm doing this, I'm going to do it enough times to where you can see some saline coming out into the syringe here. And the important thing is that you want to do this until you have reached your desired volume. So you can actually already see the saline coming out. So there's a lot of saline in this sample, but you can see that there's already water filling our backlot syringe here. So we're filtering out all that saline, which will leave you with a really good concentration of those growth factors and proteins. And you would do this until you have reached your desired volume. So you can kind of be checking yourself over here, depending on what volume you are looking for. But also, as I push it through this filter, you can see that the color is changing a little bit. It was a little bit more yellow before, and now it's getting a little pinker. That's also just due to that saline leaving. So when you have that volume that you are wanting to work with, you will do the same thing. Make sure you're pulling up a little bit on this and take that off. So now you have two samples. You would have your highly concentrated PPP. So you'd have all of your good stuff left over in the PPP in this syringe, and you'd have your buffy coat and your PRP in this syringe. So depending on what you want to do, you could use those for different situations, or if you wanted a little bit more volume in your PRP syringe, you could supplement it using the syringe. Let's do that. We have a luer connector here. Let me get that open for you. Basically, we're just going to attach this onto our PPP syringe, as well as our PRP syringe. And if you wanted to work with your PRP, you would just dispense some of this into the syringe until you had your desired volume. So we went from like 7 to around 11. And then this would be your final product that you could re-inject. Before I kind of talk about a few other things, is there any questions on how I use this device or how the two-step was working?
Gracie, we had one question from the audience that was talking about not having to rebalance, but they were asking about 10 milliliters that was taken out of the two-step and the counterbalance wasn't reweighed. Could you speak to that? I missed it.
Yeah, for sure. So we only didn't reweigh because I was showing you what it would look like to do to pull the PRP out. Usually you would not do that in a loop site 4 prep. So you would just pull out your PPP, put it in the back chamber, and immediately respin. So you wouldn't usually be losing any volume there. I did, however, take out the PRP just to show you guys what that would look like if you're doing a standard PRP spin. But that's kind of like what I was saying. So I took out a small enough amount to where the centrifuge is obviously going. So you kind of have some error room to work with. Because the PRP was such a small amount, I wasn't needing to reweigh.
Okay, perfect. Thank you. Another question we had is the ART PRP Plus good for A2M concentrations?
Yes, it is very good for A2M concentrations, as well as IL-1 and IRAP. It's really good at all of those things. So it's really good for anti-inflammatory effects, as well as signaling to start the healing cascade, all of those good things that you're looking for when you're re-injecting or even doing fake shit. Any other questions right now? Cool. Well, we only have 2 seconds left on our second set of our 2 steps, so we can go ahead and transfer it over back to that. Just want to slow down a little bit faster. It just depends on your centrifuge. Obviously, these two are different. This is an LXY, whereas this one is a Drucker. And LXYs are the ones that we're currently sending at this time. See, it's shaking a little bit more now because I took that extra 3 to 5 cc's out. So if I would have reweighed it in a perfect world, it is a lot smoother. But yeah, it'll still run if you're that much off on your counterbalance weight. And if anybody else has any questions, I will take some after we process this at chamber. All right, so for this one, you can see that now this is a lot more yellow than it was when we started or when we put it back here to spin. So I don't know how well you can see this, but there is a cell pellet that formed down here. It's that little white kind of pellet, I guess, down here. So that is the concentration of those growth factors and proteins. The ones that we were just talking about, like A2M and IL-1, all those good things that you're looking for, they are down here in this pellet. So we are going to pull that pellet out, again, using our pin components. So the back chamber is a little bit more touchy than the front chamber, just because before we get that pellet out, we're going to draw off this excess saline at this point. So again, it's really important to make sure you unlock your syringes in this draw specifically, because any hard pull on this first little draw up will affect the pellet. And right now we are trying to leave the pellet completely alone and kind of just draw up off of the top here. So I'll show you what that looks like. So you can kind of see these little hash marks here. These are milliliter marks. So if you know that you need, say, 6 cc's for reinjection, you can draw off your saline until you get to that 6 cc point. So I'm going to shoot for around 6 cc's now. But again, you want to make sure that you're pulling super slowly on this first pull so that you're not disturbing your pellet. And again, you're just going to draw up until you hit your desired volume. You could go all the way down to 4 or 10, but we're going to use that leftover volume in there to resuspend the pellet. So just keep that in mind before you pull too much off the top. So I stopped at about 6 cc's there. So this is just going to be excess. Again, if you needed supplemental volume, you could use this that you pulled off. You have that. And now we are going to resuspend that pellet. So make sure you unlock your syringe for this as well. I'm going with a 10 cc syringe here. And what we're going to do is rapidly pull up and push down on our syringe until this pellet is resuspended. So what that's going to look like is like this. We're going to do it about 10 times. You just want to make sure you can kind of see that obviously now the pellet is resuspended. You can't see that little white blob over there anymore. And you want to make sure that you're getting as least amount of bubbles as you can in this. It can be a little difficult just because you're obviously creating some bubbles just from the force of pushing up and down. But after you've done about 10, you will pull everything up into your syringe, and this would be your final product. So in this case, you would have this as well as your leftover saline that you could supplement with. So the 2-step's really cool because it's giving you 3 really good avenues for anything, any fluid that you need. So you would have your PRP, had you collected it from the front chamber, you would have your resuspended pellet and your leftover saline. So you have all 3 aspects of this preparation right in your syringes. So that is it for our 2-step. I will take any more questions that you guys might have. Any questions? Awesome.
If
Well, oh, sorry.
I was just going to say, if nobody has anything else, we wanted to thank you guys for the time. And, obviously you can reach out to myself or a number of your reps if you have any questions about the products themselves. If you have any higher level questions about orthobiologics in general or platelet-rich plasma or bone marrow concentrate injections, just get in touch with our team and we'll make sure to put you in touch with one of our on-staff PhDs or one of our consulting physicians, and they will direct you as far as clinical papers or supporting literature, really anything that you need to sort of discuss applications and different biological constituents for that. So thank you all, really appreciate the time, and we'll talk soon. Thank you.
Thank you, guys.